Hello, I'm Dr. Michelle McGowan.
And I'm Dr. Tim Hennig.
And we're from the Center for Ankle and Foot Care in Claremont, Florida. And we've been doing these little videos, and we are really good at doing them for a couple of days in a row.
Yeah, life gets in the way.
But we have 3 kids.
And a new Instapot.
And whatever. And we're doing the whole virtual school, running our office, and the whole kit and caboodle. So we want to talk to patients because, this coronavirus, this is... like, it got real. It's not...
It's going to get worse.
It's not going away. It's going to get worse before it gets better. Obviously, everybody's seen that on TV. And we want to just kind of stress that we are available for telemedicine visits as well. I mean, we are seeing emergencies and more emergent different foot and ankle problems in the office.
But even some of those can be done over the phone. I had 3 today. A couple people went to the ER last week with broken bones. I said, fine, just stay home. I'll log in the hospital. We can look at your x-rays. Whatever you need, we can figure it over the phone for most of it.
I think there's a lot of creative ways we could do telemedicine too. Besides, we're on staff at a couple different hospitals. And yes, we can always dial in and with your permission, get access to your x-rays, your MRIs, anything like that. But in addition to that, even if you have pictures you can take, you can text them, email them to us, and we can still be very beneficial for you, but not getting into the office. So, of course, everybody knows no doctor should be doing any, especially podiatrists, any elective foot surgery. You shouldn't be going in for your bunion, your hammer toe, your painful whatever. If
it ain't broken and bleeding a lot.
That's not emergent.
It's not emergent.
If it's not infected, if it's not something where if you don't go in and clean it out, you're going to lose a limb, nobody should be doing it, because that way you're protecting the medical professionals that are out there on the front line. You're
not using supplies.
You're not using supplies, the personal protective equipment that all doctors and nurses use on, to help.
Not to mention that's where the coronavirus is going to end up, is these places. So you don't want to go get stuff.
So you don't want to be in the hospital for something elective and then wind up having, come down with the coronavirus. So we just want to stress that if we're not saying that you need to put off your problem entirely. If you have questions, concerns, and it's something we can do in a telemedicine environment, we absolutely can. The other thing, we have patients who are sick, immunocompromised, but they're still experiencing things like foot pain, or they may have something they're really concerned about, but they're afraid to get in the office, or maybe they may have milder symptoms or have tested positive for coronavirus, and we don't want to see them in the office, and they don't want to go to the office. So, we can do a telemedicine visit.
Absolutely. It's easy.
Yeah. And it's almost like if you're somebody who has cancer, or you're somebody who, you're like, gosh, this is red hot and swollen, but I'm really afraid.
If you're 60 or above, you can be healthy.
The current guidelines are if you're 65 or older, you should be staying home.
But even if you're a 25-year-old smoker who vapes, we don't know.
Well, do smokers vape too?
Yeah, they could do both.
Oh, well.
Either way.
Don't you do one or the other? I don't either.
If you're ruining your lungs and you get corona, you're in bad shape.
You're in bad shape, yeah. Or even if you have asthma.
Yeah, exactly.
If you have asthma, you should be staying home and doing a telehealth.
I think
if you
we're all
really
supposed to stay home regardless.
Yeah, everybody is, but medical professionals are here to help you, so you don't feel completely like, is this redness? Is this okay, or is this black and blue area? Or you know what I mean?
Absolutely.
I want to talk a little bit about the ways we are doing telehealth. Since it is kind of wide open right now, we're doing telehealth, doing
FaceTime's working pretty good.
Yeah.
Been doing Skype.
Zoom. I like Zoom, but I guess there's been some issues with Zoom with compromise with.
Well, the Zoom,
not in our
issues.
But I guess
people
touch my face.
They try to log in and they put in code and a number, and it's not as easy as FaceTime or Skype. You just put the number and they go.
Skype, I feel like an old person when I talk to younger people. They're like, Skype. What is that?
My grandparents use that.
But
I get it.
But even for our older patients, a good old-fashioned phone call, and if you don't know how to use these things like Skype or Zoom,
cell phone and pictures.
Cell phone, you can email a picture, you can text a picture. We have all those things available for our patients. just to help out in this time. So you're staying away from the ER. Though I know that's the big thing right now. I mean, I get updates because I'm on staff at a couple different hospitals of where the hospitals are losing money because they're not seeing as many patients in the ER. But you don't want to go to the ER. If they're losing money, I'm sorry, but I wouldn't go to the ER right now.
No.
I wouldn't go.
Unless you're having a hard time breathing, you think you're going to die.
Yeah, exactly. I'd go to the ER if you think you have coronavirus.
Agreed.
Otherwise, I wouldn't go. And then we haven't been able to do these as frequent as we'd like, mainly because all the time. But we bought an Instapot, and that's what you wanted to talk about.
So, due to lack of time, I broke down and bought one of these Instapots over the weekend.
Oh my God, they're amazing.
You can make like anything in like 15 minutes. It's phenomenal. We had one vegan pad thai. It was awesome.
Oh, it was really good. Anyway,
and they're on Amazon.com, $80.
We're not selling them.
Well, no, but I bought one for $120. Like they're $80 on Amazon.
Yeah.
But we wanted one Sunday.
Sucker.
So that's...
Anyway, so if you have any questions, or if you're just interested in learning more about foot and ankle problems, our website is centeranklefootcare.com. Our phone number for our office is 352-242-2502. On our website, we have a telehealth. Like, it's on every page at the top header. If you want to request a telehealth visit, just click on that sucker. You'll get one of us as the person that you'll talk to, either via Skype, Zoom, FaceTime.
Just let us know. We'll figure
or
it out.
phone. I've had a couple of patients that, I even had a young patient. He was like 35. We just talked on the phone. It was a follow-up, and he just didn't want to come and get anybody else potentially sick, even though he didn't feel sick, you know. Anything else?
No, I think I'm good.
Yeah, I'm Dr. Michelle McGowan.
I'm Dr. Tim Henning.
We're from the Center for Ankle and Foot Care, and stay safe.
Wash your hands 6 feet.